Good morning. I am Dr. Nima Aghaebrahim. I'm a stroke neurologist and a neuroendovascular surgeon. And today I'm going to be talking about introduction to stroke. So, what is a stroke and what happens when a stroke happens? Well, whenever there's sudden loss of brain function due to change in a blood vessel in the brain, that is a stroke. Stroke is an emergency, and stroke is number one cause of disability. So it's very important to know the signs and symptoms of stroke and to be able to provide treatment and prevention. There are typically two types of strokes. There are bleeding kind or a non-bleeding or ischemic kind. So when there is a blockage in one of the blood vessels, that it leads to loss of brain function in that area. That is called ischemic stroke. However, when a blood vessel bursts, that leads to bleeding in the brain. That is called hemorrhagic strokes. So when you talk about ischemic stroke, that can be caused due to different reasons. When you look at the brain, as you can see, the surface and the inside of the brain have these blood vessels that carry blood to different part of the brain. So whenever there is a problem in one of these blood vessels, that area of the brain gets damaged. This can be caused due to one of the smaller blood vessels can get blocked. For example, due to diabetes, high blood pressure, or cholesterol, these little blood vessels can get blocked, and that is type of stroke. Or a blood clot in the heart can form, and that can travel up to the brain and block one of these maybe larger arteries. That is another type of stroke. Other causes of ischemic stroke are due to narrowing of the blood vessel in the neck, the carotid artery or vertebral artery, and that can also cause stroke. There are also different causes of ischemic stroke and hemorrhagic stroke, which I'll be talking about it in another talk. It is very important to know that time is brain. Every minute and every second that passes, when there is a blockage in a blood vessel, brain cells start dying. So it's very important to act fast. To do that, we all need to know the signs and symptoms of stroke to be able to recognize it and to be able to provide appropriate care. There is an acronym that we use called BFAST that can be remembered to remember signs of stroke. The bottom line is different part of the brain controls different things in the body. For example, the right side of the brain controls the left side of the body, and the left controls the right. The left side of the brain usually also takes care of speech and language. So any loss of function or any weakness or numbness on one side of the body, that can be a stroke, especially when it's sudden. Or if somebody suddenly cannot speak or see, that can also be a stroke. So let's go through the BFAST acronym. B stands for balance. So if suddenly somebody cannot walk correctly or has balance issue, that can be a stroke. E stands for eyes. So if somebody cannot see all of a sudden, that can also be a stroke. FAST, the F part stands for facial weakness. So if you see somebody's face on one side gets weak or droopy, could be stroke. A stands for arm weakness. So if somebody's arm gets weak, cannot move one arm, that's very important to know that there could be a stroke. The S stands for speech. So if somebody cannot talk or understand, a lot of people think that they're confused, but in fact that could be because they have inability to talk, and that can also be stroke. And T stands for time, because when a stroke happens, it's very important to know that time is of an essence. When it comes to stroke, there are prevention. So there are certain things that we can all do to prevent stroke from happening. And also when a stroke happens, there are treatment available that can be provided in appropriate patient. So if signs and symptoms of stroke is seen, somebody needs to call 911, and EMS is equipped in recognizing stroke and can bring the patient to an appropriate place where those treatment can be offered fast. And then when stroke happens, there are things that we can do to prevent the stroke from happening. Those different areas will be discussed in the future talk. Thank you very much.